Thanks for joining us tonight at 11. I'm Amber Grigley. Mental health support for LGBTQ Hoosiers may be at risk. This comes after the federal government proposed eliminating funding for a crisis hotline that helps members of that community. WRTV's Nico Panisi explains the potential impact.
Those experiencing a mental health crisis can dial 988 for help, but funding for a program that serves LGBTQ youth is at risk of being cut. The National Suicide and Crisis Lifeline was there for Shay Estelle when they needed it most.
If I couldn't sleep, if I couldn't get my mind off it, if I was having an episode, my parents had called a couple times.
Estelle lives with borderline personality disorder. Last summer, they were experiencing frequent erratic episodes. Calling 988 helped.
Genuinely, without that line and that time, there's a very good chance I wouldn't be here.
The life-saving care Estelle received could be going away. A leaked budget draft reportedly revealed plans to get rid of the Lifeline's LGBTQ+ youth specialized services. The program is funded through the U.S. Department of Health and Human Services and could be on the chopping block as soon as October.
It makes me deeply afraid of the very real impact it will very quickly have and has already had simply from this news story on these very vulnerable queer people.
Kathy Slaughter is a licensed clinical social worker who's worked with LGBTQ youth for over 15 years. Slaughter says mental health services in general are in short supply.
And when you add the extra layer of being culturally competent and affirming towards LGBTQ people, that demand supply problem gets even worse.
Suicide is the third leading cause of death among 15 to 24-year-olds, according to the Centers for Disease Control and Prevention. LGBTQ young people are at significantly increased risk.
There have been no resources, and when you put that together with the way that people are treated, marginalized, denied housing, even denied acknowledgement of their relationships, you increase mental health issues, you increase suicide rates.
Estelle encourages others to have compassion.
Think about this being your kid. Think about this being someone in your family.
In Indianapolis, Nico Panisi, WRTV.
Mental health experts recommend the Trevor Project as an alternative. It can connect you to a trained counselor who understands the challenges of LGBTQ youth.